Hello, this is Eddie Garcia, Senior Vice President at Healthsperien, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy. Brought to you by Healthsperian, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and business strategy. On today's episode, the Healthsperian team, national thought leaders, and advocates dive head-on into the often politically sensitive but very real issue of health and financial disparities and how the COVID-19 pandemic presents itself among the vulnerable and communities of color. We'll explore the causes, public responses, and policy solutions to address these inequities, with a special focus on how we quantify and qualify the issue through accurate data and human stories. Thanks for joining us. Up first, your weekly Healthspiration, a moment to reflect on the bigger picture.
I am Tom Kasumpas, President and founder of Healthsperien. Coronavirus disparities are real. According to the latest data on COVID-19 infections, 33% of those hospitalized were African American, but African Americans only make up 13% of the American population. One of the most misleading notions today is that coronavirus impacts all of us the same. It does not. It does not medically, economically, socially, or psychologically. What we are reminded of here is the long-standing American ideological struggle between the concepts of equality and equity. While the coronavirus makes no differentiation on who can be a victim, our society's underlying inequities, historical structural violence, and unaddressed social determinants of health have only been further exacerbated in minority populations from the COVID-19 virus. The current pandemic challenges us all to face ourselves in the mirror and ask, what nation are we today, and who do we want to be moving forward? If we truly are the greatest nation in the world, with wealth and resources beyond comprehension, we must and can do better. As all Americans are forced into the shared experience of the COVID-19 era, my hope is that we reconcile the fact that America is only great if we all are great.
Now join Healthsperian policy experts and friends for Stay in the Know, a weekly policy segment on the top health policy issues we're facing this week.
I'm Andrew McPherson, Managing Partner here at Healthsperian in Washington, D.C., and welcome to Stay in the Know. The COVID-19 outbreak presents extraordinary health and financial challenges for communities of color across the nation. Communities of color are at increased risks for experiencing serious illness if they become infected with the coronavirus due to higher rates of certain underlying health conditions compared to their Caucasian counterparts. They experience increased financial and health risks associated with COVID-19 due to economic and social circumstances. For example, right here in Washington, D.C., studies are showing that while African Americans, for example, make up 45% of the total population, they make up about 59% of deaths related to COVID-19. That is not an unusual statistic. We're seeing very similar numbers across the country, and that's what leads us to our discussion today.
I'm thrilled to introduce our panel today for Stay in the Know to talk about healthcare disparities as it relates to the coronavirus pandemic. We are just joined by three extraordinary national experts and leaders in the healthcare industry. Frederick Assassi, who is Executive Director of Families USA, a leading national nonprofit voice for healthcare consumers across a range of public policy arenas. Niall Brennan, who is President and CEO of the Healthcare Cost Institute, a premier research institution highlighting trends in U.S. healthcare spending and the factors behind those trends. And then Yanira Cruz, who is President and CEO of the National Hispanic Council on Aging, the foremost public policy and advocacy organization driving equity in the Latino perspective within public health older adults, and caregiver issues. Thank you so much for joining us today. I'm going to start with Frederick. Frederick, multiple studies have shown that people of color are less likely to have a job that they're able to perform from home during the pandemic, making social distancing much more difficult. Those who maintain jobs amid the COVID-19 outbreak, such as grocery store workers, delivery drivers, et cetera, are at a much higher risk of contracting coronavirus, given that they remain exposed to other individuals. What does this mean in terms of healthcare coverage for communities of color? And what should Congress be doing to ensure that these individuals have access to coverage and to care?
Well, Andrew, thanks so much for having me here. It's a real pleasure. And thanks so much for focusing this discussion on communities of color and the COVID crisis. I think it's such an important conversation to have. As you point out, what we know right now is around the country, all American families are really struggling with this pandemic that we're faced, and it's both a pandemic and a financial crisis. And unfortunately, as more and more information comes out about the impact of this pandemic, what we're finding out is that communities of color and families of color are being disproportionately impacted, much more negatively impacted by this disease than white and other families. It's really disturbing, in particular African-American families and Hispanic families. And as you point out, there's a lot of reasons why. Part of it is for a lot of families, they don't have access to regular health care because they might not have access to health insurance in their jobs. They're working hard, but their employer doesn't offer them health insurance. It might be because of underlying comorbidities like diabetes or overweight or obesity. It also is about environment. We know, for example, COVID is infecting a lot of folks. It primarily infects your lungs and causes respiratory distress. And a lot of the communities that are being most heavily impacted are communities with really poor air quality. And so families are being raised in environments that make them more susceptible. And as you point out, another really important factor is that a lot of these folks are at the very front lines of our response, either as folks who are cleaning and working in hospitals, either as healthcare providers or on staff, people who are working in the emergency response units, folks who are working to make sure that food is in our grocery stores and that it's being picked in our farms. And so we have a long list of recommendations that we are prepared, and we're joining with about 300 other organizations delivering to Congress tomorrow morning. A big focus of it is making sure first that people have access to all the healthcare that they need at this time with real financial security. So making sure that either through COBRA or through the health insurance exchanges or through Medicaid, that everybody has access to high quality health insurance that provides real financial security. Second piece is making sure that these frontline workers, not just healthcare workers, but all of the folks who are currently still having to go to work, are getting access to a safe work environment, and making sure OSHA really is establishing what the right standard should be, that personal protective gear is available, that folks are working 6 feet apart, all those really important recommendations. And then finally, that we are understanding, analyzing, and releasing data at a very rapid rate about the impact of this illness across all families, and making sure that those data are being reported according to race and ethnicity so that we can understand if there is, in fact, segments of our population who are being left behind.
Thank you, Frederick. And Yanira Cruz, to that issue of coverage, which is just so critically important facing a range of communities of color and minorities, talk a little bit about what the Congress has done so far to ensure that communities of color and minorities do have high quality healthcare coverage, or at least access to coverage, and talk about what the Congress has done or what they need to do with respect to removing cost sharing for treatments and future vaccines as it relates to the pandemic.
Thank you. Thanks for the question, and thanks for inviting me to the panel and paying attention to such an important issue right now that is impacting all of our communities, especially brown communities and Black communities. I applaud Congress for the 2 packages that have been passed that are helping to alleviate some of the impacts caused by COVID-19. Having said that, there are very serious concerns with regards to disparities impacting our communities that are not being addressed by these responses that Congress has taken thus far. We have to go back a little bit and acknowledge the fact that the disparities that we're seeing today as a result of the coronavirus pandemic has to do with a history of discrimination and a history of disparities in our country and among communities of color. And so this takes us back years. And now with COVID-19, we're seeing those systemic deficiencies in the system that we know have been there for years, and now they're becoming very obvious. I think we need to engage with every community, whether they are rich, poor, documented, or undocumented. The reality is that this pandemic does not discriminate against color, against the person you love, or whether you are documented or not. And so I think we need to engage in this process of public health prevention and control of this pandemic, regardless of what our history is and our background is. And second, as we move forward in implementing strategies of testing or prevention or treatment, I think we need to recognize that cultural competency and language competency are important in this equation, and that we must adhere to those elements that we know are important for our community to respond, to understand, and to engage. There is a reality just went through, which is the issue of public charge. And so that public charge that took place last year has caused many communities to not come out and access services offered by the government as they are afraid to have negative consequences for themselves or for their families. And so I think we need to figure out a way to acknowledge that fact that the public charge issue is there, and it's an element that will keep communities from coming out and accessing services. I think we need to engage organizations, particularly nonprofits that have an expertise in working and doing outreach and engagement with diverse populations. They know how to engage and connect with communities of color, LGBTQ communities, immigrant communities. And so I think we need to engage those nonprofits that are trusted by community members. I think that element of trust is so important here. I think the issue of data and gathering data according to age and ethnicity is important, absolutely. Otherwise, how would we know how we're doing as a population with regards to this pandemic?
Terrific. Thank you. And now, Brennan, speaking of data, we're just beginning to see the CDC releasing multi-state information about how the pandemic is impacting communities of color. Walk us through what you're seeing with respect to the data and disparities in the pandemic, both in terms of health and health care for minority populations.
Yeah, thanks very much, Andrew. It's a pleasure to be on the podcast with Frederick and Yanira. And I want to really reiterate their responses that a lot of what we're seeing comes down to structural inequity and the fact that minorities and persons of color don't necessarily have the luxury of staying at home and teleworking and doing podcasts like we do. So from a data perspective, it's been really quite disheartening, and I think it has exposed some pretty fundamental gaps in our health data ecosystem. I think CDC is trying its best, but it's, again, not a good sign when you read the Morbidity Mortality Weekly Report. You see that race and ethnicity is only reported for 8% of the total respondents. And, these reports are also based on antiquated data collection methods. They're basically questionnaires. I think on the good news side of the spectrum, there has been a surge of public-private partnerships that are emerging, trying to help to fill this data gap. People have, FDA have convened large groups of people, CMS are working with people. We're really having to almost build this from the ground up. Are there ways in which we can execute structured queries across hospital electronic health records in order to understand how it affects people with different comorbidities, understand how it affects people with different age groups, figure out what the disease progression and outcomes are by race and ethnicity. The funny thing about COVID-19 is that, well, it's not funny at all. In many respects, it's a great equalizer. I fully respect respect and understand Frederick's point about ensuring that everybody has good healthcare coverage. And I know, particularly among minority populations, lack of health insurance or lack of access to health insurance over time has led, and other inequities have led to a preponderance of the comorbidities that seem to make the condition worse. So I don't want to lessen that impact at all. But the reality of this disease is you can have the greatest health insurance in the world and it can kill you in 24 or 48 hours. So we have a lot of work to do. And I think we're just on the cusp of hopefully starting to see better data that will help us answer some of these questions over the next few weeks.
Terrific. Thank you, Niall. Frederick, unfortunately, it's impossible to ignore, the political dimensions related to healthcare disparities. I think what we've seen so far with the Trump administration was the president being criticized for what some considered a lengthy delay in producing this federal data that Niall was referring to with respect to racial disparities in outcomes as it relates to the pandemic. How do we overcome the tendency to politicize the issue of healthcare disparities in America and how we deliver care to communities of color? And how do we raise the visibility of this critically important issue with Congress? So far, I don't think we've seen the Congress do much of anything to really protect communities of color. So talk to us about how we raise the visibility of this issue going forward.
Terrific question. I think first and foremost, we have to really make sure that we are bringing forward the real experiences of these families. As we talked about, we as Americans are having this shared experience right now. It's once in many lifetimes kind of experience. And it's changing the way we think about ourselves, our society, and the people who are our neighbors. And I think one of the big lessons that we're learning out of this experience is how much our health is interconnected and how my neighbor's health matters to me because it's also about my health. And also, you can't leave anyone behind. And as you had pointed out earlier in the podcast, some of the folks who are being left behind are the very people who are fighting and working every day on behalf of all of us. And so I think one of the questions that we're raising at families is, through this shared experience of COVID, as terrible as it has been, perhaps it's opening our minds to the interconnectedness of health and the fact that all families, their health matters to each of us, but it also matters that we leave no one behind.
To that point, Yanira Cruz, how do we raise the visibility of this issue with the Congress? We're in a very polarized political situation here in Washington, but how do we cut through? To Frederick's point, is it personal stories? Is it really sharing those stories that will help cut through the political toxicity in Washington?
Yeah, I think we need to humanize this issue and present with real images and stories the realities of our communities. We also need to bring awareness among our communities about the importance of following public health practices and science rather than being misled by political rhetoric that is often not in line with public health, not in line with science. So I think as leaders at a national level, it's our responsibility to ensure that our community understands the importance of public health, understands the importance of adhering to science. Our communities have a voice and they have a right to communicate with their legislators. This may be an opportunity to be more aggressive and do campaigns to write to their Congress and pick up the phone and make phone calls and put pressure on political leaders and bring the real stories of people suffering. We have older adults, for example, at our housing facility who are not able to go out to the grocery store and buy 2 weeks worth of groceries because they live in a fixed income. And so how can we expect older adults from staying in their home if they don't have the financial means to be able to adhere to some of the public health practices that we're asking them to do? And bring the realities of our communities to national legislators. The issue of collecting data by race and ethnicity and gender is more important than ever. As you know, funding is allocated based on what data shows. So I think we need to, again, put pressure on the administration to ensure that data is being collected so that we have a clear picture of who is being affected, who is being impacted by this epidemic, and how. Those elements will help us sort of not politicize this issue as this issue is a human issue. It's a matter of death, a matter of health.
Now, Brennan, I want to drill down on this point of the data that we need to make the case to the Congress, to the state legislatures, to a whole range of policymakers. Walk us through what this data, what we should be looking for. We're getting some preliminary numbers, for example, around the impact of the actual virus, of who's becoming ill, who is dying as a result of the virus in minority communities. We're starting to get some data around the economic impact and related to income, for example. But what's missing? Paint a picture for us from your perspective of what that data really needs to look like to make the case of why it's so important to protect vulnerable populations.
So on the one hand, the data is actually not missing. We've just made a series of policy decisions over the years that has led to the data either being siloed or stored in such a way that you can see it, you can almost touch it, but you can't actually get to it. I think the best example is, I sort of can't believe that we have invested 30, 40, $50 billion over the past decade in incentivizing providers to digitize their entire systems, install electronic health records, and yet there's no way for the government to sort of execute a structured query or call across all those systems to answer important questions about disease progression. I mean, those decisions were made and there's no use crying over spilled milk. So a lot of the early results, again, are frankly based on tiny sample sizes. It's like 48 patients at a hospital here or 100 patients at a hospital there. So we need to try and scale all those numbers. We need to understand disease progression, disease outcomes, who is going to the hospital. When they're at the hospital, how quickly are they getting to an intensive care unit? If they get to the intensive care unit, are they ending up in a ventilator? If they end up in a ventilator, are they recovering? If they're recovering, do they recover with kidney disease? The questions go on and on and on. And that's just from the clinical sense. From a broader societal data endpoints, I mean, it's a little bit outside of my wheelhouse, but again, it's clear that we lack a fundamental understanding, certainly a data-driven understanding of where the pain points are going to be and the economic pain points are going to be. I mean, I just find it hard to believe that a $1,200 check is going to last the average American family a very long time when you factor in rent and food and utilities and different things like that. And again, that will disproportionately affect minorities and people of color. So I think we need a big effort to understand what's going on there as well. Flipping back to health too, we know that nursing home populations are exceptionally vulnerable to this effort. We know that some nursing homes are better than other nursing homes, but we need to harness that data to proactively identify nursing homes or other areas where hotspots might emerge.
Final question for each of you, and we'll start with you, Niall. If you were on the president's COVID-19 task force, what would be your top recommendation to the president and his team to ensure that we support minority populations throughout the crisis, and both for the short term and the long term? Niall.
If I was on the COVID-19 task force, okay, I mean, this is not rocket science and is something that you read in the papers every day. It just really, I'm very surprised and disappointed that as a country, we have not been able to scale up testing yet. Because if we were able to scale up testing and target that testing at particularly frontline workers or people who are more likely to be exposed or affected to the disease, I think we would be able to take more aggressive and measured steps to both understanding what's going on and hopefully slowly releasing the economic stranglehold on our country. I think in the longer term, and this is probably almost certainly naive and unlikely to happen, I do think in some respects we've come together as a country. It's manifested itself in different ways. There's certainly a lot of political toxicity still there. But I do wonder, will it change people's perception regarding healthcare and access to healthcare? I don't know how the COVID-19 task force would view that long-term recommendation. But, when you think of it, in many respects, you couldn't design a healthcare system more poorly equipped to deal with something of this magnitude than the US healthcare system. You've got people who are uninsured, you've got people who are underinsured, you've got the structural inequities that we've talked about that manifest themselves in higher chronic conditions among minority populations and people of color. You've got surprise billing. You've literally got people who are afraid to interact with the healthcare system in case they get a $3,000 or $4,000 or $5,000 bill. That does not seem, that is a petri dish for infection, not a petri dish for containment.
Yes. Yanira Cruz, your top recommendation to the president and his team.
Well, I would say we need to ensure that communities of color are included in clinical trials and research so that as we look for a vaccine, for example, for COVID-19, we want to make sure that we have a good representation of African Americans, Latinos, American Indians, Asian and Pacific Islanders included in those trials so that when the treatment comes out, we know for sure that treatment will work well with us. So we need to make sure that historically, we know that's not been the case. Our communities have been left out of research and clinical trials. So specifically on COVID-19, we want to make sure that our communities are included in those trials, in that research. And moving forward, we know that more pandemics will come in the future. And so moving forward, we want to make sure that our communities are at the table in terms of clinical trials and research. And more broadly speaking, I think diverse populations, brown communities, Black communities have a huge problem with chronic illnesses that we are all familiar with. Diabetes is on the rise, cardiovascular diseases are on the rise, obesity is on the rise. And so we need to address those things because those very risk factors are the ones that are getting us in trouble with conditions like COVID-19. So I think for COVID-19, we need to address the chronic illnesses, but more importantly, down the road, when we get hit by other pandemics, we will need to be in better shape as society, and we can't leave our brown and Black communities behind.
And Frederick Assassi, Families USA, your top recommendation.
Well, I think, broadly speaking, I couldn't agree more with my fellow panelists. I think first and foremost has to be follow the science, has to be allow public health experts to drive our response. Now highlighted the importance of testing, tracing, and quarantining to make sure as we move out of this phase that we don't have another even more intense spike of illness. Really, really important. So I'd say there's no question that's got to be the starting point for the president if he really wants to protect all families, all communities. Two, I would say to run towards the problems that are being surfaced, which is not necessarily something that politicians often do, but the possibility of tremendous progress is there if we, as a country, really examine what's happened and the experience. And as Niall says, in some ways you couldn't find a system that's more poorly designed to deal with these kinds of public health, community-wide healthcare crises. So let's examine that and let's figure out all the ways. And Niall certainly, Yanira also highlighted some of the real key deficiencies. But then finally, for communities of color who really are suffering at such a higher rate during this pandemic, I think it's got to be that we really ask the question why. We let the data drive us. So I think, as you've heard from all three of us, we've got to be collecting and reporting data so that we can understand how this is impacting these communities differently. And then we have to make a commitment. And I think it would be really powerful for the president and for candidate Biden to make a commitment that coming out of this crisis at the beginning of the next Congress, when they're sitting down to write their 100-day agenda, whoever it is, they are committing to a package of reforms to really address the deficiencies that this illness has highlighted for all families. And then, as we've discussed, and in such an unfair and un-American way towards communities and families of color.
Well, Frederick Assassi, Executive Director of Families USA, Yanira Cruz, President, CEO of the National Hispanic Council on Aging, and of course now Brendan, President, CEO of the Healthcare Costs Institute. Thank you so much for this discussion.
And here is our industry foresight.
Hello, this is Jean DeSasse, Senior Partner at Healthsperien and President of Healthsperian X. Disparities in healthcare outcomes, disparities in mortality are a pressing problem in today's healthcare system, with or without the pandemic. Low-income populations, people in minority communities, people in rural communities face challenging in accessing high-quality care and addressing and managing underlying chronic conditions. Other vulnerable populations, including seniors, also face higher morbidity and mortality and challenges in getting access to high-quality healthcare. The arrival of COVID-19 underscores many of those challenges with vulnerable seniors. We still are learning a lot about the mechanism of disease and its transmission, and important lessons will come from more exploration of the impact of underlying chronic conditions on vulnerability to the COVID-19 disease. That might include diabetes and the impact, for example, on minority communities who are more vulnerable to COVID-19 because of underlying chronic conditions. We're also looking at how those falling ill with COVID reveals the challenges that lower income communities face in terms of living in multifamily homes, requiring public transport, for whom the pandemic has made it difficult for them to be able to socially distance safely. And so for many of them, frontline healthcare workers, workers in supermarkets, workers in the existing retail that's helping to support the broader community, many of those individuals are working there because they still need to support themselves and their families, and to an extent they're putting themselves at risk. And so as we're looking at how COVID is affecting them and their families and their communities, it's going to be important to look at low-income factors and the disparities that low-income communities face in accessing care. Furthermore, the impact on health of the widespread shutdowns is also going to emerge as we learn more about the disease and its transmission and the effect of people as we start to come out of the widespread shutdowns. What services have been unnecessarily delayed? What has been the impact of chronic conditions on the health of families that have had to stay at home in challenging environments to prevent disease transmission, but have led to a neglect of underlying healthcare conditions? Ultimately, COVID-19 will be a call to action on longstanding problems faced by the healthcare system in addressing healthcare disparities, chronic conditions, the needs of vulnerable populations. More than that, we need to understand what data is emerging in real time and offer protections as we go and as we learn to the most vulnerable, and focus on targeted containment and access to treatment. Thank you very much.
For our last segment, here is our outlook for the week ahead.
Hello, everyone. My name is Melissa McHale. I am a health policy analyst at Healthsperien, and I'm going to talk about some of the things that are coming up this week. As we know, Congress is going to currently be in recess until May 4th. We know last week they came together to pass an interim economic relief package known as the Paycheck Protection Program and Healthcare Enhancement Act, which basically added more funding to the Paycheck Protection Program, $321 billion, as well as an additional $100 billion to the Public Health and Social Services Emergency Fund. This came after a lot of back and forth between Democrats and Republicans about just allocating funding to the Paycheck Protection Program versus including more funding for hospitals. Currently, Congress is still having discussions on what needs to be included in the fourth and potentially final economic relief package. However, as it goes, Congress is currently struggling to find an agreement on how and when they will execute this fourth package. More specifically, Speaker Nancy Pelosi, she wants to include a more robust package. As they've been discussing, they want to extend more benefits to average Americans. They want to expand unemployment benefits, as well as workplace safety protections for frontline workers, and also provide more funding for Food Supplemental Nutrition Assistance Program, also known as SNAP. The other side of the coin is that Senate Majority Leader Mitch McConnell, he and other Republicans have been reluctant to include a robust fourth package of funding. They're indicating that they're reluctant to be on board with these issues. And this is an election year, so everybody's kind of buckling down along party lines. And Senate Majority Leader McConnell even released a press release saying point blank that he didn't really want to give funding to state governments because he didn't think that they needed, quote, a blue state bailout. So we may be seeing a lot of this partisan rhetoric going back and forth as Congress continues to determine what comes in this bailout. Another point is that him and other Republicans are starting to say that they need to slow down on releasing more funding. They just released over $3 trillion within the past few weeks, and they want to slow down the pace of deficit spending. So with that, Speaker Pelosi has also confirmed that for this fourth interim package, the bill language will specifically start in the House. As you know, the last two bills we had seen started in the Senate and were negotiated with Treasury Secretary Steve Mnuchin. So we're going to probably see some language come out of the House first within the next couple of weeks. But for now, we are going to be seeing this partisan stalemate on the components that will go into that funding package. And that's everything you need to know coming up this week.
That concludes our episode for this week. Thank you for tuning in. If you have any questions on anything you heard on this week's episode, please head over to Healthsperien.com for more information and deeper analysis. And as always, tune in next week for more health policy insights and discussion.